Okay, so my name is Jason Wheat. This is a video talking about how I would interact with a patient who is going through alcohol withdrawals. At this point in time, I would be entering the room, knock, 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 and then the patient would say, okay, you can come in, and I would introduce myself. Hi, my name is Jason Wheat. I am a student RN that will be taking care of you today. The purpose of this visit is that I'm going to assess some of the symptoms that you've been experiencing, and I'm going to give you a little bit of information about where those symptoms you're experiencing may be coming from. The patient at this point in time would say, oh, okay, sure, I'd like to talk about that. And then I would ask the patient, can you please give me your name and date of birth? The patient would respond with Cedric Slow, May 21st of 1972. At this point in time, I would complete hand hygiene. I would verify that that is the correct patient, which Cedric is indeed the patient that I will be experiencing or talking to. And I would first introduce by asking, how are you feeling today? And the patient could respond in a manner that would be like, well, I've definitely been feeling better, or I definitely have felt better, but today I'm feeling okay right now. And while the patient is talking to me, I would be trying to make sure that I'm on an equal level so that I'm not above the patient and I'm not speaking down onto the patient, so we're at an equal level. I'm making good eye contact with the patient to let them know that I'm listening to them. My posture is in an open posture. I'm not closed. My hands aren't folded up, so I'm not keeping myself away from the patient. And then I'm watching the patient's eye contact as well, the patient's posture, if they're very reserved, very uptight, and very concerned. And then at this point in time, I'd also be looking at the appearance of the patient's age in comparison to the documented age. Their attention span, whenever I'm speaking to them, can they keep a conversation going, or are they staring off into space and busy doing something else? And their body language as well. Are they interested in this conversation, or are they invested somewhere else at this point? And then another question that I would ask when I'm first assessing how he's generally feeling today would be, what would you like to start talking about first? And this is just a way to allow the patient to take the lead, and they can get a good feeling that I'm here for them and that they want to, or that they have control of this conversation. I'm not just lecturing to them. It's a back and forth conversation. And Cedric would say something like, I think that we could start with a few questions about my thinking first. I would respond with, okay, Cedric, we'll start with that. Could you tell me where we are today, what day, month, and year it is, and what my name is? And Cedric would respond with, well, we're in the hospital. It is 2021, and your name is Jason. Now, Cedric, because his attention span is not that great, he left out the day and the month of the year that we're currently in. So I would follow up with, Cedric, could you tell me the day and the month of this year? And he would respond, oh yeah, it's the 11th of March. So at that point, I know he's oriented to person, place, and time, and that will be of assistance with another assessment tool that we use with the alcohol withdrawals that will be coming forward. And then going forward into a little bit of a mental exam, I'm not going to directly tell the patient that I'm going to assess his mental status, but these are just going to be questions that I'll get a good feel for how he feels, other people perceive him, what his perception of other people is, and any feelings of self-harm that he may be experiencing. So the first question I would ask is, how do people treat you, Cedric? And he would respond with, I just feel like people are ignoring me all the time. And a response that I would give would be, you're frustrated with the way people are ignoring you, and that is a therapeutic response using restatement to try and help the patient, or try and have the patient give me more information about how they're feeling. And it works better than asking a direct question saying, how do you feel that people are ignoring you? So he would respond with, yes, I want to get to understand people better and communicate with them, but they never seem to respond to me. And then I would ask a follow-up question with, has there ever been another time in your life where you felt this occurred, or is this only recently? And this would be a use of another therapeutic response that would be an encouragement of comparison, where I'm trying to get a feel if this patient has experienced something like this beforehand, or this client, I'm sorry, not patient, it's a client. If this client has experienced something like this before in their life, or if this feeling of isolation and inability to communicate is only related to this point in time in their life. And then Cedric, the client, would respond with, there were times in high school where I felt this way, but this feels worse than those experiences. And that also could contribute to the recent loss of his friend in his life and the current changes he's going through in his life as well. And then when I move on to a question about self-harm, I could ask Cedric, do you feel like hurting yourself now? And he would respond with a blunt, just no. And I would respond with, have you ever felt like life is not worth living? And he says, yes, but that is behind me and I don't want to talk about it now. At this point in time, I'd understand that the patient is not comfortable. I don't want to keep poking around on these questions because the patient does not want to speak about it, and I don't want to upset the patient when I know that that's not a topic that they're comfortable speaking about right now. So I would follow that up with, thank you for answering my questions. I'd like to ask you some questions about your current feeling while you're in the hospital here. Is that okay? And he says, yes, you may. And that's where I'm now transitioning over to the CIWA assessment screening for withdrawals of alcohol use / substance abuse. So one of the first questions I would ask would be, do you feel nauseous or have you been vomiting lately? He would respond with, I feel nauseous but no vomiting, and it's begun since I've been here. And another question I would ask was, have you been experiencing any anxiousness? And he responds with, I'm okay. At this point in time, I would respond with, I've heard that you're okay, which I perceive to be no anxiousness. This is because it's not a direct response to the question of anxiousness, so I wanted to verify that what I thought that he told me, which was when he says he's okay, he's not experiencing anxiousness. I wanted to clarify that with the patient, which would be verbalizing the implied. And then the patient responds, well, I am a little bit anxious. Actually, a pretty good amount. And at that point in time, that little bit of further clarification gives me a more accurate response rather than just taking the initial I am okay as the patient's response. I would move on to say, I can see the beads of sweat forming on your forehead, which is something that I'm making an observation, another therapeutic response, such as the verbalizing the implied was a therapeutic response as well, where Cedric would respond, it is really warm in here, isn't it? And I would respond with, it is warm in here, but I think you're a little more sweaty than usual. And at this point in time, I would also assess the patient's palms of their hands, or the client's palms of their hands, to determine how sweaty those are as well, to make an assessment based on that 1 to 7 scale, or 0 to 7 scale that was provided on the screening tool. The next question I would have is, have you experienced any itchiness or any pins and needles sensations while you've been in this room? And Cedric would respond, I felt moderate itching, but no pins and needles. Another question I would ask was, has the lighting been irritating you? And if so, how much? And Cedric would respond, it's been slightly irritating. And at this point, Cedric would not be sitting here anymore. At this point, he would have gotten up out of the bed and he was pacing around the room. And that, for me, would be evident of agitation. So I would ask the patient, are you okay? Is there anything that I can get you? If you can, try and take a seat and just take some deep breaths and just try and clear your mind a little bit, because I can see that the patient is clearly agitated. And at this point, I would try and use some de-escalation tools to help calm the patient while he's experiencing this state of agitation. And then another question that I would ask would be related to the screening tool would be, do you perceive your hands as doing anything right now? And instead of just asking, are your hands shaky? Are you experiencing tremors or anything like that? I would allow the patient's perception to guide my assessment, which is a therapeutic communication tool, which would lead for the patient to give me a description of their perceptions. And the patient would say, I don't think they're shaking or anything, unless I put my hands out, which therefore I would ask the patient to just stick their hands up for me, and he would be shaking a little bit. Moderate tremors. And some of the other assessments that are going on that I don't actually need to ask the patient, just based on assessment, what I see the patient doing would be that the patient's pacing the room. And before the assessment had begun, I had already asked the patient of orientation of person, place, and time. So that is something that I would not need to ask again. And the final question that I would ask related to this screening tool would be, are you aware of any sounds around you, and are they any more louder than usual? Do they startle you, and have you heard anything that disturbs you that you know isn't there? And Cedric would respond with, no, I don't hear any of that. I don't think I'm crazy. And then, I'm sorry, there was one other last question, and it has to do with a headache. And I would ask the question, does it feel like you've had a band? Do you have a band around your head? And he says, I feel like I have a very light band around my head. And I would respond with, when you say you have a very light band, what does that mean to you? And that is a form of therapeutic response that is specifically related to focusing on a specific term, specifically the very light band that the patient responded with. And the client, Cedric, would respond with, I would say, a very light headache, which is that final assessment tool question. And after this, the patient scored a 32 on the CIWA screening tool, which shows that the patient is experiencing alcohol withdrawal symptoms. And at this point in time, it would be appropriate to communicate that to the provider after you've collected vital signs, which at this point in time, on a real patient, I would collect the vital signs. And for Cedric, it would be found that he would have an elevated heart rate of 110, elevated blood pressure of 152/91, a respiration rate of 22, which is elevated, a temperature of 99.8 degrees Fahrenheit, which is elevated, and a pain level of 3 out of 10. All of these things I would make sure to communicate to the provider, which I would let Cedric know before I leave. I would say, thank you for your cooperation. I'm going to speak to your provider to come up with a plan of action to help you feel more relaxed. And a plan of action, informing the patient of a plan of action being provided, is a form of therapeutic communication, as the patient understands that you're not just listening to them just to listen to them, to write it down and move on and just not and forget about the patient. Letting the patient know that you're going to develop something to help improve their condition, to help them move forward and to make it back to a normal standard of living, can provide them a little bit of comfort where they may not have had it beforehand. When I would return back to the room, I would make sure to say, first I would make sure to verify that I have the right patient. So I'd ask the patient their name and date of birth again, perform hand hygiene again to make sure that I'm completing good safety practices. And then I would say to the patient, Mr. Slow, I can see that you're agitated, and as you're pacing around the room and are focused on many things. The provider has determined that the best plan of action would be medications to help with your agitation. This would be a way to, a form of therapeutic communication when I spoke about Mr. Slow's agitation, by attempting to translate words into feelings. So I can see that he's pacing around the room. He's looking around. He doesn't have very good concentration, so I can see that he is agitated. But I want to verify this with the patient to let them know what I'm seeing so that I can have a better idea of what's going on. And the patient would be like, okay, so what is it that you want to give me? So I would tell the patient, your agitation is most likely related to alcohol withdrawal that you may be experiencing, and it's presented in other symptoms that you're showing, such as tremors, nausea, diaphoresis, and elevated vital signs. And the doctor would like to give you a normal saline with thiamine and folic acid, and this would help you with the tremors and protect your Wernicke-Korsakoff areas of your brain, which are important for speech comprehension and forming proper sentences. And also the doctor would like to give you a benzodiazepine, and this would help you with your elevated vital signs. It would help bring those down, as if you keep an elevated vitals, if your vital signs remain elevated, you may experience things such as seizures, and there could be problems with your brain, such as the damage to your Wernicke-Korsakoff's area, which would lead to more confusion and more confusion. And some of the adverse effects of those benzodiazepines would be confusion, drowsiness, or dizziness. And that's why we think it'll be important to keep you overnight while we administer those medications, so that we can monitor your status and make sure that those medications are working for you. And then at this point in time, I would ask the patient if they have any questions about the medications that they're going to be receiving, if they would like those medications, because we have to make sure that the patient wants the treatment that is provided. And then before I administer the medications and before I'm about to leave, I would tell the patient, I want to let you know that I'm here for you, and if you have any questions about anything that you're experiencing or any of the medications that you're going to be given, make sure to ask me, let me know. And that's just me offering myself to the patient to let them know that I'm there for them and that I will be there to help them in any way that I possibly can. And that is my interview with an alcohol withdrawal patient, specifically Cedric Slow. Thank you.